Hello guys, welcome to my channel Catch22. Today we are going to develop a simplified approach towards NCCT brain, which is an important topic from your exam point of view and as well as a commonly ordered investigation in your daily clinical life. So let's start. So we'll be dividing the video into four parts. The first part will be on basic alignment of the structures in the CT scan brain, and I'll be teaching you how to hold a CT scan plate in the correct manner. The second part will be on Hounsfield units. The third part will be an introduction to the basic anatomy of the brain. And lastly, in the fourth part, we'll be looking at examples and trying to solve them together. Okay. So we'll be looking at the alignment of the NCCT brain plate, how to hold it and how to read a NCCT plate. So first up, remember whenever you are handed over a NCCT plate, always place the skiagram to your upper left corner so that rest of the things become much simpler and aligned for you. Now understand one thing, in NCCT brain you are looking at horizontal cuts of the brain from the level of the foramen magnum to the tip of the vertex, and you are looking from below upwards from the foot end of the patient. Okay, so that means at this point here you are looking at the foramen magnum. Now on the subsequent cut it is a little above that. Thereafter you reach the base of the brain. So you read the NCCT brain as per the directions of those arrows given in this slide so that you can read the subsequent cuts. Also, as we are looking from the foot end, this means this is the right and the left portion of the patient's brain, right and left. So now we are clear about the alignment, both the vertical and the right and left alignment of the brain in NCCT plate. Now we'll be looking at the densities of the various structures in NCCT brain. The densities are also, you can also call it the brightness of different structures. So understand that it ranges from plus 1000 to minus 1000. Plus 1000 is that of bone or metal and minus 1000 is that of air. Now 0 is the density or brightness of water here. Now we have to compare the brightness of various structures to understand what pathology lies underneath. So remember those values of plus 15, plus 20, plus 25 and plus 40 and also plus 80. So plus 15 is the density of CSF or brightness of CSF, plus 20 is that of infarct, plus 25 is that of white matter and plus 40 is that of gray matter, and plus 80 is the density of hemorrhage. So the thing to note here is that infarct is hyperdense to CSF and hypodense to white and gray matter. At the same time, hemorrhage or clot is hyperdense to gray matter but hypodense or lesser bright than the bone or metal. Okay, now this structure is the gray matter here in this CT scan, and this structure is the white matter. This particular pathology is an infarct, and this particular pathology is a bleed. This is a very interesting NCCT plate with loads of findings. So here the gray matter has a Hounsfield unit of plus 40 and white matter has that of plus 25. Now you see the infarct is brighter than the CSF but lesser bright than the gray and the white matter, and the hemorrhage which is of plus 80 Hounsfield units is brighter than the gray matter but lesser bright in brightness than the bone or metal. So I hope we are clear about the Hounsfield units and the brightness of various structures in NCCT brain. Now we know about the alignment of the CT scan plate. We also know about the Hounsfield units. So now we'll be looking at the anatomy of the brain. So see, the purpose of introducing to you the anatomy of the brain in a simplified manner is the fact that it will be easier for you to correlate the location of the various pathologies in NCCT brain after understanding the basic structures of the brain and the brainstem. So now we'll be dividing the anatomy into two parts. The first part will be anatomy of the soft tissues, and the second part will be anatomy of the ventricles. Now we won't overcomplicate the anatomical considerations and just see four basic points which we need to remember to read NCCT brain plates. So this structure is that of the brainstem, and the first structure that we come across is medulla. Above that lies the pons, and above that lies the midbrain. This is our first anatomical consideration that we should keep in mind while reading a NCCT brain plate. Now, the second thing is the circle of Willis. Now, this is the internal carotid, the anterior cerebral arteries, the middle cerebral arteries. We all are acquainted with the anatomy of the circle of Willis. These are the posterior cerebral arteries, posterior communicating arteries. So, this is the anterior cerebral artery, the middle cerebral artery, the posterior cerebral artery, the posterior communicating artery, the anterior communicating artery, and the internal carotid artery. Now, the thing to remember is that the pituitary stalk lies at the center of the circle of Willis. This thing you should keep in mind while reading reading a NCCT brain plate. Now, the third consideration is that the cerebrum is divided into the frontal lobe and the parietal lobe by the central sulcus. So this portion is the frontal lobe and this is the parietal lobe. Now the fourth thing that you should remember is that if this is the coronal section of the brain, of the region of the central sulcus, the fibers from the gray matter, the white matter fibers arise like this, forming the corona radiata, and those white matter fibers passes through a constellation of nuclei known as the basal ganglia, which is formed by the nuclei arranged like this. I'm sure you are acquainted with this diagram as well. And this nuclei is that of the head of the caudate nucleus. This is the thalamus. This is the putamen. And this is the globus pallidus. And the white matter fibers from the corona radiata passes in between them. And this tract of white matter fibers is known as the internal capsule. So now you remember those 4 points while reading an NCCT brain plate. We have simplified those things. So remember the structure of the brain stem, the circle of Willis and the pituitary stalk lies at the center of it. The central sulcus divides the brain into frontal and parietal lobe, and lastly the internal capsule. Now we'll also consider certain things about the anatomy of the ventricles. We all know this is the lateral ventricle and it has an anterior, posterior, and a temporal horn. This is the third and the fourth ventricle. Remember, this is the structure of ventricles when we are looking at a person standing in anatomical position from the left side. We have to remember certain structures in relation to the ventricles. We already know that the structures in front of the fourth ventricle, that is the roof of the fourth ventricle, is formed by the medulla and the pons. This is the pons. And also the temporal horn of the lateral ventricle lies in the temporal lobe. That means when you are looking at serial cuts in NCCT, the temporal horn will come earlier than the anterior or the posterior horn. Also, the presence of the temporal horn will denote that you are looking at the temporal lobe. Now we are done with the anatomy of the brain. So now we'll be looking at a console video of NCCT brain. So students usually get confused by the name console. See, console video is nothing but a continuous video of the various cuts in NCCT brain. We'll be looking at it so that we get a better understanding of the various structures that we see in NCCT brain.
So let's jump to the console video first.
Now we'll look at the structures one by one below upwards. Here you can see the foramen magnum with the medulla and the corrugated structure, the cerebellum. Now we'll move upwards. Here you can see a Darth Vader-like structure, the pons, and we know that behind the pons lies the fourth ventricle, and behind it is the cerebellum. Now again we move upwards. As we move upwards, we can appreciate the sella turcica here, and we should remember that inside the sella turcica lies the pituitary. So above this level, here lies the pituitary stalk. Now we know that surrounding the pituitary stalk lies the circle of Willis, and behind the circle of Willis, we know that the midbrain is situated there. So now as we move above, here lies the third ventricle, and here lies the temporal horn of the lateral ventricle, and we also know by now surrounding the temporal horn lies the temporal lobe. Now as we move upwards, you can appreciate certain hyperdense structures here. These are the calcification of the choroid plexus and the third ventricle. Now you can get confused that why is it not a bleed? This is because these are benign calcifications because of two reasons. One, they are bilateral symmetrical or central, and two, they occur in certain anatomical areas only. Like in this case, the choroid plexus and the third ventricle. Also, these two structures are the Sylvian fissures. Now, always remember the temporal lobe ends at the appearance of the Sylvian fissure. So, now the lobes that we see in this area are the frontal and temporal lobe. Now, again, in this slide, you can notice certain nuclei here. So, this is the basal ganglia, the caudate nucleus, the putamen, the globus pallidus, and the thalamus, and in between those nuclei lies the internal capsule. Again, as we go upwards, we can appreciate the anterior horn of the lateral ventricle and the posterior horn of the lateral ventricle. Now, as we move upwards, here we can see a omega-like structure. This structure is nothing but the central sulcus, and it divides the cerebrum into the frontal and parietal lobe. Okay, now as we move upwards, we reach the end of the vortex.
Now I hope that you are well acquainted with the various structures that we see in NCCT brain in our daily life. Now we'll be looking at various examples of different pathologies that we come across commonly in NCCT brain and try solving them together. So let's start.
Now let's start with the examples of the CT scan. Now first up, remember whenever you are given a NCCT brain plate, the first step is to hold the plate in proper position. Now we by now know that to hold it in proper position, we should keep the skiagram of the plate in the upper left corner. Now the second step is to scan sequentially. This is the foramen magnum, and we should scan the subsequent slides in this manner, in this direction, so that we do not miss any pathology. And the third step is to detect the pathologies. Now let's start with the pathologies. Now let's start with our first example. We'll detect the pathology in those two examples. Now the thumb rule to read a CT scan is to compare both sides of a CT scan. Now see, in the first example, you can see certain hyperdense lesions in both sides, but they are bilaterally situated. That means they are benign. So these are CP calcifications like we have seen before in the console video also, and this is the third ventricle calcification. However, here there is a hyperdense lesion, hyperdense to CSF but hypodense to the surrounding soft tissue. That means this is an infarct. Now what about the location of the infarct? Now, I hope you can appreciate by now that these two are nuclei, the caudate nuclei, the putamen globus pallidus and the thalamus. That means this particular structure is the internal capsule. So this is a infarct located in the internal capsule, and this is the right and the left side. So this is an infarct in the left internal capsule. Now infarcts less than 20 mm are known as lacunar infarct. You can remember that info. In the second picture, here there is calcification again. Now see, when we compare both sides, you can again see a hypodense lesion that is hyperdense to CSF but hypodense to the surrounding gray and white matter. So this is also an infarct. Now what about the location? This is located in the frontoparietal region. So this is a left frontoparietal infarct. Now, in this example, there are four structures. Now, you see hyperdense lesions in every example here, but they are not symmetrical, neither are they in usual places. So, they are not calcifications, they are intracerebral hemorrhages. Remember, this is different from intracranial hemorrhage, which includes subdural, epidural hemorrhages, subarachnoid hemorrhages also. Now let's find out the location of every hemorrhage here. Now in the first example, you can appreciate the basal ganglia, the caudate nucleus and the thalamus. So this is an example of ICH at the level of the left internal capsule and basal ganglia. Now in the second example, you can appreciate the area of the circle of Willis. That means behind it lies the pons and the midbrain. So this is an example of ICH at the level of at the level of brain stems, the pons and the medulla. The pons and the midbrain. Now in the third example, you can appreciate the rugosities around the hyperdense lesion. So this is an example of ICH at the level of the cerebellum. And in the final example, you can appreciate the frontoparietal lobe and the midline shift. So this is an example of ICH at the frontoparietal lobe with midline shift. Now this is another interesting example. Now by now I hope you have realized that all those four examples are that of bleed due to the presence of hyperdense lesion, but the structure of each of those lesions define the area of the bleeds. In the first example, it has spider like the bleed has spider like legs, and therefore this is an example of subarachnoid hemorrhage. This particular pathology has occurred at the level of the circle of Willis, as you can see by now. In the second example, the bleed is concavo-convex. This type of structure is given by a subdural hemorrhage or SDH. In the second example, half of the SDH is hypodense, which means that it had occurred previously, and half of it is hyperdense. That means it is a new bleed. So this is an example of acute on chronic SDH. And the last one has a biconvex shape, and this is an example of extradural hemorrhage. A simpler way of remembering SDH is that if you close an S, it gives a concavo-convex shape, and if you close an E, it gives a biconvex shape. So this is how you can remember EDH and SDH. Now we look at certain very special examples. In the first picture, you can notice a cavity with fluid inside. So this is an example of an abscess. Now by now we know that this is situated in the left frontal lobe. Now in the second and the third example, you can see hyperdensities in the both the pictures, but in the second picture there is a surrounding hypodensity. This is known as perilesional edema, which is absent in the third picture. You see there is no perilesional edema here. So the presence of perilesional edema suggests that this is a mass and it is located in the right parietal lobe, as we can see, and the left one is a left basal ganglia hemorrhage. In the fourth one, you can see certain ring-like lesions with central dot, which is basically the scolex. So these are example of neurocysticercosis.
That was the video, guys. I hope I have been able to develop a simplified approach for you towards solving NCCT brain. If you have any other confusion, kindly write down on the comments below, and I'll try my level best to answer those things. Also, I had put up a video on decoding ECGs. The link is given below in the description. Kindly click on it to understand ECGs better, and also like, share, and subscribe the channel. Thank you.